Hello and welcome back to Vet Nurse Rambling. Apologies for the slightly weird setup I've got going on here, holding my microphone out. I've just done some video clips and it's been rustling against my jacket and it sounds horrendous, so I thought I would do it this way just to see whether it sounds a bit better. So I thought I'd come on here today to do a quick video about the top 5, in my opinion, most common emergencies that we see in a veterinary practice. Obviously in our profession we're quite used to kind of noticing the signs and symptoms of an emergency fairly quickly, but I think it's really important that pet owners are kind of aware of things to look out for, just so that we can obviously target the problem quicker, which will ultimately mean that we've got a better outcome and a better outlook for the patient. So I just wanted to highlight these emergencies so that people can be a little bit more aware and act a little bit quicker. So the first problem that I wanted to talk about is something that we call bloat or gastric torsion, which can also be known as GDV, which stands for gastric dilation volvulus. This is a common problem in large breed and deep-chested dogs, and can often occur once they have either eaten a meal too quickly or exercised too soon after a meal, and effectively the stomach starts to swell up and can sometimes twist. It doesn't always have to twist, it can sometimes just bloat, but this can cause kind of compromised perfusion, so blood supply to the vital organs in the body. As the stomach starts to swell up, the pressure on the kind of arteries and vessels that link all of the organs in the abdomen can become compromised, and this really is a touch and go situation. It's really serious. So the symptoms to look for with this sort of problem: obviously, a swollen abdomen is going to be the most kind of telltale sign, but you'll also find that the dog might start to drool excessively, so kind of salivate a lot, kind of lip smack as though he or she is feeling a bit sick, and potentially retch. You also will find that the colour of their gums will change, so it will either start to look pale or potentially even grey or blue. This is really serious and needs urgent veterinary attention. So if you've got a deep-chested dog and you notice any of these symptoms, you need to phone your vet straight away, because this really is a life or death situation. Outcome wise, if the surgery is performed quickly, so if the symptoms are noted nice and quickly and the surgery can be performed straight away, some dogs recover really well from it. It just depends on how quickly the problem is noted in the first place. Number 2 is a fairly obvious one as an emergency, but it's probably something worth mentioning, and that's if your pet is involved in a road traffic accident, which we abbreviate to an RTA. So if your dog or cat or any other animal is hit by a car, it's really important that you seek veterinary attention as soon as possible, just to make sure that there are no kind of lasting injuries that have occurred, so no neurological problems, no broken bones, no kind of puncture wounds or anything like that that could compromise the respiratory system and cause lasting problems, and really just check that the pet's not in shock and isn't going to kind of have anything lingering that could cause a problem later on down the line. So if your pet is knocked by a car, just get them checked over by the vet as soon as possible, just to make sure that there's no injuries that could cause problems further down the line. Number 3 is something called a Pyometra, which we shorten to Pyo, and this is effectively an infection in the reproductive organs of an entire, so non-neutered or non-spayed female dog. It generally happens with older dogs, but I have seen it happen in a 4-year-old, which is really unusual, and this can be a really kind of touch and go situation as well, and is definitely an emergency. So effectively what happens in this situation is an infection starts to grumble in the reproductive organs and slowly starts to kind of spiral out of control. As the infection gets worse and worse, the uterus, so part of the reproductive system, swells up as it fills with pus, and obviously it can only stretch to a certain amount. Once this then ruptures, which is basically where it pops open, this can cause sepsis. So the infection then can spread to the bloodstream, and obviously this can be serious kind of times. So we need to act quickly. So generally the symptoms with this would be if you notice any lingering signs of season after the season's finished, so any discharge still coming from the back end. Also excessive drinking and urinating, so we call this polyuria and polydipsia. Any kind of signs of excessive urinating and drinking, lack of appetite, lethargy, kind of inappetence, and just general depression, feeling out of sorts, it could potentially be a Pyometra. So if your dog is an entire female of a certain age. Generally it's kind of 8 years upwards, but as I say, can happen effectively at any age. I've seen it happen in a 4-year-old, and is exhibiting any of these signs, then you definitely need to get in touch with your vet ASAP. Number 4 is slightly more difficult to be specific about, because it can kind of present itself in lots of different ways and can cause lots of different problems as well. But number 4 is poisoning, which we also sometimes call toxicity. Obviously you can't keep an eye on your pet 24/7, so you're not always going to be able to see exactly what they come into contact with, but there are certain kind of plants or substances or just stuff that if they come into contact with can cause severe problems. So if you notice that your pet is kind of out of sorts, perhaps having gastrointestinal upset, they may well have ingested some sort of toxin. If they seem lethargic and they've been maybe outside rummaging in the garden and having a good old sniff around in the bushes, in the shrubs in the garden, and they're perhaps not wanting to eat, this could also be a toxicity. But it's impossible to give a kind of definitive list of things to look for because toxins present themselves in all different shapes and sizes, so it's a little bit more tricky for me to be specific, unfortunately. However, there are some toxins that are particularly kind of prevalent at this time of year. Antifreeze poisoning is something that we see on a fairly regular basis, especially when it gets colder. This is effectively ethylene glycol, which can cause severe kidney problems, especially in cats, because it's a kind of liquidy substance that's sometimes spilt on the driver in the garage when you're topping up your car. Sometimes cats will mistakenly drink from it, and this can cause kind of crystals to start forming in the tubes that link up the kidneys, which is kind of the filtration system of the body, and this can cause long-lasting problems and potentially can unfortunately lead to acute renal failure, which can cause death, unfortunately. So it's really important that you're super vigilant if you are topping up your car with antifreeze to make sure that you don't spill any, and if you do, you clean it up straight away. The other thing to be careful for at this time of year is kind of raisin or grape or dried fruit toxicity, especially with our greedy dogs that like to get their hands or their paws on everything. So for example, mince pies or Christmas pudding. This can cause kidney problems, which can be fatal as well. So it's really important that they don't have access to anything like this. Definitely aren't fed them by their owners, because this would just be a disaster. But if they do jump up on the side and manage to snaffle a few sneaky treats, then phone your vet straight away, because if you notice it within the first kind of hour of it happening, we can make them sick, which will hopefully mean that they bring up the offending article, and this will obviously mean that they're less likely to have any lasting problems. So make sure that all of the mince pies and delicious treats are pushed right to the back of the counter so that no one can jump up and have a quick snack. Falling into the category of kind of festive poisons would also be chocolate. Again, more common that dogs poach some chocolate than cats, but it can still cause a problem. So chocolate contains an ingredient called theobromine, which can cause severe problems with the kidneys and other organs in the body and can lead to death. So it's really important that they don't have a snack on any of your advent calendar chocolates or any other chocolate that could be lying around, not just at Christmas, throughout the whole year, especially if you like a little kind of chocolate feast in the evenings. Make sure that your dog does not get their paws on any, because it can be fatal and it could really kind of be dreadful. So just make sure that chocolate is pushed well out of the way so that they can't have access to it. Now, for emergency number 5, I wasn't 100% sure what to do, because it is quite a limiting number when there are so many different emergencies out there that your pet could potentially come into the vets with. But I've done number 5 as a blocked bladder, which generally is a problem in entire, so unneutered male cats, but it can be a problem with lots of different kind of genders and species as well. Effectively what happens here is a crystal forms out of some of the kind of minerals that we find in urine, and if this kind of crystal starts to accumulate, it can create a stone, which can cause a blockage, which can obviously cause a real problem if the animal is unable to urinate effectively. So normally the signs that you'll find with this is that they'll be struggling to go to the toilet. So if you've got an indoor cat that uses a tray, it's quite easy to notice this. With dogs, again, you generally see them going to the loo when you take them out on a walk and things like that. So just keeping an eye on their urination patterns. So if they are having difficulty, or if when they go to the toilet it's tinged with blood, this can, also be suggesting that we might have an issue on our hands. Generally speaking, the cure for it, I guess you'd say, is fairly straightforward. Once we've diagnosed it and found that there's a stone, a lot of the time we'll remove it. Sometimes we use a special diet which can help to dissolve the stone, and it's just a case of monitoring thereafter to make sure that the problem doesn't happen again. Now, I know I said top 5, but I just wanted to slide this one in there because I think it shouldn't go unmentioned. Is kind of difficulty during birth with female animals. So we call this Dystocia, and quite often you will find that either the dog or cat or rabbit or guinea pig or whatever has been kind of giving birth to some of their babies, and there might be one that's either stuck or they might just show signs of kind of struggling to push, which could be due to exhaustion but could be due to something going on inside. So if there is any kind of signs of struggling during birth, during labour, then this is also a veterinary emergency and should be kind of rectified as soon as possible. I know that I said 5 and I know that I've done 6, but I just wanted to pop that one in there because I don't think it should go unmentioned. So there we have it, my top 5/6 veterinary emergencies. Obviously when I say top 5, it's not kind of my 5 favourite ones or anything like that. It's just the 5 that in my experience seem to be the more frequent ones that come into veterinary practices. Obviously there is a plethora of other emergencies out there that can cause so many different problems, but they are just the 5 that I generally have seen on a more frequent basis. So if you've got any questions or concerns about anything that I've spoken about today or any emergencies that I haven't touched upon, then please either just comment below or drop me an email and I'll be happy to have a quick chat with you. Watch this space, I'll be doing another video soon. Thank you so much for watching and see you soon. Bye.